Hi to you all. I am Dr. Anand Prabhu Sude. I am a founder of Mangal Prabhu Nursing Home at Juinagar, which is 35-bedded hospital. Today I would like to discuss about malaria with you people. Why malaria so is? Due to season now we can see lots of people coming with malarial cases in the hospitals. This is a small video to let you know about malaria, how you can identify malaria, how would you diagnose malaria, how could you have to guess the symptoms or signs so that you can go ahead and come to hospital for diagnosis of the malaria and then treatment of the malaria. Basic now, malaria worldwide, why it is so important that it kills around approximately 6 lakh people per year throughout the world. And same with the Indian scenario, we have lots of poverty which is there, we have lots of environmental factors which have to be improved so that we can totally eradicate malaria from India. Why Navi Mumbai? Navi Mumbai was an endemic for malaria. In recent years now we have very less cases have been decreased. Now only we get cases across when we have a season, that is monsoon coming, where the rain floods are going on or water storage, water logging is seen, then only these malaria beats on it. So now how does you define malaria? Malaria is a parasitic disease which comes across. It has 4 subspecies of malarial thing. It's known as malaria, falciparum malaria, which is the most dangerous, where you have cerebral malaria and deaths are more inevitable into this. The other malaria is Plasmodium vivax. Now even this has shown some recent changes in the species and you're getting symptoms with neurology also now. Then you have oval and malarial. All these 4 types of malaria which we see across. How does it spread? Wherever there is water logging, these female Anopheles mosquitoes which breed on this, then they get infected, then they give merocytes which are there in their salivary gland. When they bite you, after 10 to 14 days the cycle is there in your blood, and then the schizoids which are destructed or merocytes which are released will give you symptoms. So one should understand that when a mosquito bites, not instantly within 1 day or 2 days you would get a malaria. It would take approximately 10 to 12 days to manifest this. Now for mothers, important signs how to recognize whether the child is suffering from illness or not. He may present initially with very high grade fever, abdominal pain, vomiting, distension. Also will have hot stage or cold state, like he'll be very much shivering with incidence of fever. He would ask more and more blankets for his help to keep him warm in a cold stage. These are the 2 things which hot stage, cold stage you can identify with the symptoms, and then go back to the hospital or refer doctor, whichever you go, and then get it investigated done. Basic investigations, clinical signs and diagnosis are the important things to look into a public variations, how they occur. Everyone may not perceive all these symptoms what you see according to the textbook. You may have severe headache or you have severe vomiting. Someone may come with convulsion, someone may come with hypoglycemia, someone may come with respiratory symptoms, someone can have an acute kidney injury. So one should be able to identify and then treat. Most of the malaria we usually treat them on OPD basis, that you see the symptoms, you identify, then you send investigation. Like routine blood investigations, what we send is CBC, rapid malarial antigen test or peripheral smear. These things which we come across and we identify and treat. Combinations wise, we had chloroquine, other drugs. Nowadays drugs have become more resistant, so we stick on to the ACT regime, which is a newer one, which is combination of artesunate with lumefantrine, which comes as an oral preparation as syrup, which will be there as 5 mg. Each 5 ml syrup would contain 20/40, 20/140, 20/250 combinations depending upon what strength you would like to use. Most commonly we usually calculate it as per the weight, like first 15 to 20 kgs, 20 milligram combination is better. If you go on to 25, then you need to go on to 40. If you go on to 35 and above, then you need to go on to 60 or 80 combination which comes. It's a 3-day regime, twice a day for 3 days, it should suffice, and then you can take care of it. these ACT regimes should be followed under the supervision of doctor, because they would have side effects, vomiting, other things which your doctor would help you to reduce them. Usually they are being taken with antacids, so prior taking these medicines, vomiting medicines are given so that you don't vomit out the medicine out. After you get into these clinical symptoms and diagnosis, treatment, most important part for society is to prevent it from happening. It usually depends upon the parasitic index which is there. Any malaria which we come across, we divide into two bases, that is a complicated, uncomplicated. Uncomplicated malarias can be treated on OPD basis, or maximum they need 1 to 2 days, 3 days of admissions. If it is a complicated malaria, like earlier said, that if it manifests with respiratory symptoms, if it manifests with kidney injuries, if it manifests with seizures, most commonest thing in cerebral malaria, you fit or convulsion what you come across, and people are scared for it, and the mortality is high depending upon the parasitic index. If you have a parasitic index more than 10, then definitely if it is a complicated malaria, cerebral malaria with convulsion, then the mortality is too high. It goes up to 69 to 70%. So one should be able to identify complicated and uncomplicated cases of malaria and treat accordingly. And best part is to prevent, and you have relapse also. Like after you treat this malaria with medication, after 3 weeks again the patient or children may get this malaria, that is known as relapse. For prevention of these relapse, there are some medicine like primaquine which can be taken on day 3 of the medication for 14 days, so that the eggs or gametes which are there in the blood again gets mature and produce malaria. So that can be prevented. So relapse is one important thing one should keep in mind. Then second is to take help of factors where these environmental factors where and say prevent malarial spreading. Like we have nets as a physical thing, we have DDT powders which have been sprayed, or we have other liquids, chemical which have been polycarbonate, they have been put on the water surface, or there are some fishes which have been put in ponds so that these eat larvae so that mosquito doesn't breed onto it. So these are some environmental factors and physical factors which could come to your help in prevention. These are physical prevention that you can take care from not happening, but once you happen, you need to go under medical supervision and then get treated accordingly. People at home level, what a mother would like to is to keep her house clean, healthy, so that the commonplaces, waterlogging, don't store too much of water. If you keep a storage, then you have mosquitoes breeding onto it. It could be either dengue or it could be either malaria. With Malaria anopheles mosquitoes, which usually is a female mosquito. So one should know that. And then if it bites after 10 to 14 days, you get a symptom and then you suffer from malaria. Then high risk regions in India about this malaria, Navi Mumbai was endemic area for malaria. Wherever there is lots of construction going on, where water involvement is there, water logging is there, whenever there is a construction of a bridge or something where you have to dig something and keep it open so that water gets logged, and then you can get malaria. Or your drainage system is not working well, or your gutters are full of other things which usually the plastics and which block them from going and having a free flow water, then you get all these mosquitoes breeding there and the spread of the disease is known. We at Mangal Prabhu come across these kind of malarial cases. We usually, as earlier said, divide it into complicated, uncomplicated. Uncomplicated at Mangal Prabhu are treated with OPD and blood investigations to see that they don't have these breeding mosquitoes. And then complicated malarias we treat in ICU for few hours where they really need some intensive good care. And at Mangal Prabhu we are able to give you that. Recently we had diagnosed few of the Plasmodium vivax species and few of falciparum, where we had to use artesunate injectables, and which for 3-day regime they recovered fast. The platelet count has gone down to 20-25,000. Now it has been picked up to 1 lakh and more. If you have any questions and queries regarding this video, then you can give a comment below so that we can get back to you and solve your problem.